The next session would be on the use of standardized developmental assessment tools in clinical practice by Dr. Srinivasa Raghavan R. I now request the chairperson, Dr. Lakshmi Prasad, Senior Consultant Pediatrician and Development Physician at Isabel's Chennai, to chair the session, and Dr. Srinivasa Raghavan to occupy the podium. I request the chairperson to occupy the dais and conduct the proceedings.
My honor and privilege to welcome you, sir, for this talk. Developmental monitoring, surveillance, screening. We talk of so many things. We have so many tools. What to use, when to use, how to use, what are the psychometrics. So, there are so many questions in this arena. So, we are looking forward to a very engaging presentation, sir. The stage is all yours.
So it's indeed a great privilege to be standing here before this august audience and to talk about developmental tools in office practice. So my outline of today's talk will be developmental surveillance versus screening versus assessment. What are some differences that we should know? And given the time limitation, I would like to focus on what are some of the developmental tools that will be useful in the first 5 years of life. I'd be focusing on some of the tools that can be used in a very quick and efficient manner in our OPD and in our office practice, especially the Denver 2 tool and the ages and stages questionnaire. And I'll also be talking about some free resources that can be easily downloaded. And then I'll focus on condition specific tool, especially autism. And one of the recently developed apps, which is the AS Detect app, which we can use it in our day-to-day practice. So what is developmental surveillance? Developmental surveillance means in a quick and in a non-structured manner to follow up development, it is developmental surveillance. Ideally, this should be done by it should be done for all children, by all professionals and during all patient-professional interaction. Every opportunity where a child meets a pediatrician, that should be taken up as an opportunity to monitor the child's development. Then we go for this developmental screening. Who is developmental screening meant for? Screening is done using structured tools, and it is done predominantly for children at risk for developmental delay. So some children identify to have risk for developmental delays. Once we identify them a priori, then in them we can do some structured tools for developmental follow. They may require more than surveillance, and those situations we use developmental screening. And then developmental assessment. What is developmental assessment? It is done by trained individuals. It is done for children who have been identified to have developmental delays during surveillance and screening, and they are done using some standardized tool. Examples of some developmental assessment tools that are validated in India are Bailey scales of infant development, developmental assessment scale for Indian infants, and there is also the Griffiths 3 tool. Essentially, I'll be talking today about the developmental screening and developmental surveillance tools that are approved, and we'll be seeing those which can be done in the day-to-day office practice. The first tool that I'd be talking about is the Denver tool. Denver tool is a visual tool. The simplest thing that you can do in day-to-day office practice is just by representing the child's development in a visual way, and this was developed based on this premise. You have to drop a perpendicular at the child's age. You have to use the corrected gestational age for preterms, and all horizontal boxes. If you can see here, all horizontal boxes that end before this age line, the child should have attained. Only then you give us a pass. And any horizontal box where the age line cuts through in the shaded area, which is the 75th to 90th centile, then if the child hasn't attained that, it is marked as a concern. And all horizontal boxes which end before the age line, if the child hasn't attained, you call it as a failure. So if the child has more than one caution, and if the child has any one failure, that is identified as a red flag. And Denver 2 assesses on all the 4 domains that are needed. Gross motor, fine motor and adaptive are included in one domain, language and personosocial. This can be easily done. The Blue Book of Trivandrum, Kim's Trivandrum, they have a Denver tool that is attached along with the vaccination booklet and the well baby visit, where it can be easily done by the pediatrician during each visit. If some of you want to do a more comprehensive assessment, Denver 2 has a set of milestones that are there, but if you want to do something more, then you can go for the ages and stages questionnaire. It is one of the validated tools for screening. Translated versions are available for Indian use. Hindi translations have been validated in India, and this is a tool that can again be applied from birth to 6 years. Denver 2 also is from birth to 6 years, ages and stages also is from birth to 6 years. Here you assess the language, gross motor, fine motor, personal-social, and also the cognitive domain, which is called as the problem-solving domain here. This is an example of a Denver scale, ages and stages questionnaire. First, you have to identify First, you have to identify what age group you should be applying for. So, using the corrected gestational age as well as the chronological age for term children, you identify what month questionnaire should be used. There are different questionnaires available for different age group. The first step is choosing the right questionnaire. And once you choose the right questionnaire based on the age, then you go through these questions. Most of these questions are simple parent reported questions. There are some items that has to be administered in person. So this is very simple to do. It takes around 10 to 15 minutes to administer with practice. Some of the questions are in communication domain that I have presented here. And as you can see, there are 3 categories of answer. One is yes. If the child is consistently doing the milestone that is asked for, then you mark as yes. Then the next category is sometimes, and finally it is not yet. The parents have to report the milestone in these 3 domains. You give 10 marks or a score of 10 for yes, you give a score of 5 for sometimes, and you give 0 if the child has not attained that yet. And based on that, each domain the child gets a total score. Each of these domains have around 6 questions, so a total of 60 can be got by any child in each domain. And whatever the child scores on the scoring sheet, you plot like this. So there are 3 categories as you can see. One is the dark box, the gray box, and the light box. If the child's total score falls in the light box, then you can say that the child's development seems to be on schedule. If the child's score comes in the gray zone, then you have to caution. It is a caution. You have to tell parents that I am going to suggest some learning activities. You go start these activities, and I would rescreen the child on follow. And if the child's total score comes in the dark zone, then directly you have to refer the child for early intervention and further detailed developmental assessment. So simple actionable tool that is there. Even in Denver, you will be able to get a pass or fail and a concern you will be able to get. In ages and stages questionnaire also 3 categories you will get. And what is advantage in using these 2 tools are, both in Denver as well as in ages and stages questionnaire, you get something called as developmental stimulation activity. Age appropriate developmental stimulation activities are provided. Based on the domain where the child has concern, you can choose some activities from this checklist and provide to the parents so that they can go back and start working on these things when they go home. So you are providing a solution to them before you send them. You are not only giving them a probable risk that you are not only identifying a delay, you are also providing a solution for the identified delay. Then ages and stages questionnaire is a paid tool. Denver 2 also has to be purchased. Now the Denver 3 version is coming up. Most of these are paid for. If you have to use it for commercial use, you may have to purchase the license and then start using. But for some of us working in a government setup, or for some of us working in a very resource limited setup where resources for buying these are not there, then we must know about some freely available resources that are there. The first most famous freely available tool that is there, a validated Indian tool, is of course the Trivandrum Development Screening Chart. A simple visual tool, very similar to Denver, where you just have to drop a perpendicular in the child's age group. All horizontal boxes that end before this cutoff is if the child has attained, it's a pass. And all horizontal boxes that are either cut through by the line or to the left of it if the child hasn't attained, not a problem. But this Trivandrum Development Screening Chart comes in 2 forms. One is the TDSC 0 to 3, 3 to 6, and also a language complement that is there, which is the language evaluation scale of Trivandrum, the LESS tool. That is also available from 0 to 6. So both these can be used, one complements the other, and that can be used for a comprehensive developmental follow. Then the RBSK checklist. How many of you are aware of the RBSK job aids? I'm not sure, but there is a very good checklist that is there in the RBSK manual. It is available in different age group. Here I have given one example where if you can see a child between 2 to 4 months of age, some milestones in all domains are given there, and 4 to 6 months some milestones are given. It also has autism specific questions in children between 14 to 18 month age group. So RBSK tool itself is a very good tool for screening which you can use in day to day practice. Then surveillance of wellness in young children. This is SWYC. It's a free tool. It has been developed by the Tufts Medical College and it is available for free download. The manual, the forms, how do you score, the scoring sheet, the cutoffs, all those are available for download. This is again a very good tool. Each age group, like ages and stages questionnaire, it is comprehensive. You first have to identify what tool is appropriate for this particular age group, and each age group there are 10 questions on development that are there. These development questions are chosen from different domains and parents have to answer as not yet, somewhat and very much. Instead of 10, 5 and 0, here it would be 2, 1 and 0. The scoring is quite similar. You give for very much, you give 2 marks, and for not yet, you give a 0 score. And at the end, the total score is calculated, and based on age particular cutoff, you identify if the child has had caution or if the child appears to meet age expectations. Simple to use, simple to score. Apart from assessing the development, this tool also assesses the parent's mental status. It also holistically assesses the family's wellness. It also covers few aspects of the child behavior that is there. So in one questionnaire, you can assess the child's development, child's behavior, and also the parent's psychosocial wellness. That is the advantage of SWYC. That's why it's not called as a development checklist, a wellness checklist it is called. And all these above scores will only tell us if the child has a delay or not. It only identifies delay. But how do we quantify a delay? When we have to say to the parents that your child's developmental quotient or this child needs particular help in this particular domain, there is a significant delay in this particular domain. That is what we have to look for. Because a child at 18 months of age, if he is able to do things at a 15-month level, is it a delay? Or a child at 18 months who is performing at a 12-month level, that you will call as a delay. Which is it? We often have a confusion during our day-to-day practice with regards to this. Not all children who are not attaining milestones appropriate to that age can be labeled as delay. So how do we quantify delay? The simplest method is one which we all use in our day-to-day pediatric clinic or day-to-day pediatric OPD. It's the developmental surveillance method based on milestone checklist. This is a good tool that we use for our own postgraduates and our undergraduates. This is from the Pediatrics Review Journal, Rebecca Scharf et al., where they are given a comprehensive list of developmental milestones. It has been neatly arranged according to the age and according to the domain. Gross motor, fine motor, receptive, expressive language, and also cognitive domains are given separately. This is a wonderful tool. Based on this, you first assess what is the best attained gross motor milestone for this child and what is the corresponding developmental age. What is the best attained language milestone and the corresponding developmental age. That's how you do for individual domains, and then we finally go on to see if it is a significant delay. The corresponding age of the best attained milestone is the developmental age. And how much delay is significant? This is one thing that we should all know. Significant delay is something when the developmental age is 25% or more compared to the, there is a 25% or more delay as compared to the chronological age. For example, I have shown a calculation here. The gross motor milestone of a 1.5-year-old child is a child can walk alone but not yet climbing upstairs. So child has attained something corresponding to a 12-month level. So for an 18-month-old child, 12 months is 33% below the chronological age. The developmental, the difference between the chronological age and developmental age is 6 months, which is 33% or more compared to the developmental age. That is significant. Now one example, I'm sorry, it is hidden below the text box. For language domain, this child is calling out to parents using kinship word. This child is able to name 2-3 objects when we ask. That is corresponding to 15-month level. So that delay comes to around 3 months. 3 months roughly translates around 16%. There is only a 16% difference as compared to the chronological age. That you label as developmental lag. You have to tell the parents that there is a caution in language domain, but there is a definite delay in the gross motor domain. We should start working on the child. Do you understand? That's the difference between a delay and lag. And other alternate option is for a child who is more than 3 years of age who comes to your OPD, as you talk to the parents, you can engage the child by asking him to draw some simple diagram. You can engage the child by giving him some blocks and making some design, and based on this you can decipher the child's cognitive functioning. So this is Gesell's drawing figure test, where based on the pattern that the child draws, you will be able to deduce the mental age of the child. For example, a 3-year-old child will be able to copy a circle neatly. A 6-year-old child will be able to copy a triangle, and by 10 years a child will be able to draw a cylinder. This is something which can be done within 3 to 4 minutes in a well child, but who is more than 2-3 years of age. And how the child holds a pencil also gives a clue towards the child's development. A 1.5-year-old child will be holding pencil or crayon in a cylindrical grasp, whereas a 4.5-year-old child will be using a mature tripod grasp to draw. So as the child is drawing in front of you, as the child is writing in front of you, you can make these observations to deduce how well is the fine motor development. And another simple test that you can perform bedside is the good enough draw a man test. Good enough draw a man test is done for a child who is more than 3 years of age. At 3 years is when a child can draw a circle. Circle is the first representation of head. That is why you start doing it beyond 3 years of age. Number of parts that a child draws divided by 4 plus 3 is the mental age of the child. If you see the first example, the child has drawn a head, eyes, nose, mouth, 2 legs and a hair. So 6 parts are represented. 6 by 4 is 1.5. So 3 plus 1.5 is 4.5. That child's mental age would roughly correspond to around 4.5 years of age. Again, this is not a formative assessment. This is not a holistic assessment, but this is just a rough calculation of the mental age. Parental perception of the child's functioning and methods as this are good enough in our day-to-day clinical practice. And as the child's age increases, you can see the complexity of figure further increases. There you can see the ears represented, the trunk, upper limb, teeth, all those are also represented apart from what the child has drawn in the first figure. And this is the Gesell's cube test. At what age a child can make tower of different thing. A 3-year-old child can make a tower of 9. A 3-year-old child can also make a bridge, can make one block stand in between two, and a 6-year-old child can make a step pattern. He can arrange the blocks in a step pattern. How do you do this? You need some 9 1-inch square wooden squares. You should have square blocks should be there. You should show it once. You should construct it and show it once to the child, and then disassemble and then ask the child to copy you. That is how you should administer. Only one attempt and no model should be there in the child. You should show him once and then disassemble and make him do. And that also gives a rough functioning of the cognitive age of this child. And coming on to condition specific screening, one of the most common neurodevelopmental disorder that we encounter in our day-to-day clinics is autism spectrum disorder, and MChat is one of the best tools that you can use for screening. MChat is available for free download from MChat website. Online translated Tamil versions are also available. There are Tamil, Hindi, Telugu versions that are there on the official website itself. For your day-to-day use, you can download and you can use it without any license. But if you are going to use it for research purpose or for commercial purposes, you may have to write to them and get a license before you can do. It is very easy to administer. Parents can fill them up by themselves, and you can even ask these questions with minimal training. Your front office staff also can do this. And for people who say that I don't have time for 20 questions, there is an alternative called MChat Best 7. MChat Best 7 are based on 7 critical items that are chosen from the MChat 20 questions, and this has been validated in Kerala. MChat Best 7 also has a good reasonable sensitivity and specificity as compared to the whole MChat. So the 7 questions that are there are shown here. Among this, if a child gets 0 or 2, that is low risk. Any score of 2 or more definitely indicates a high risk for autism. Here again, the question number 2 requires reverse scoring. Rest all are like any no is 1. Only for second question, yes will get a score of 1. One other simple tool that you can do in day-to-day office practice is the 3 item direct observation screen. Just doing 3 things. What are they? One, call the name of the child. Does the child respond to your name call within the 3rd or 4th attempt? If the child turns to you, turns to look at you within the first 2 attempts, the child gets a score of 0. If the child does not turn to you or to the parent's name call beyond 3 attempts, then you give a score of 2. Then point to an object. When you are sitting with the child in one end of the room, have an interesting picture or have an interesting toy on the other end of the room, the far end of the room, and get the attention of a child and point to him. Can you look at the toy there? Does the child turn to look back at it? The child should follow your gaze and child should also follow your pointing. That is joint attention. So eye contact, second thing is the joint attention. And third one is your observation of the eye contact during the child's interaction. Spend 5 minutes by playing directly with the child. Spend some minutes by observing how the mother interacts with the child. Based on that, what is the quality of eye contact? Does the child establish a very good flexible eye contact between persons, between object and person? All these can be assessed. So just by assessing these 3 items, if the child gets a score of 0, on all these if the child scores 0, it is low risk. Is it evidence based? Yes. Studies as early as 2014 has said that this 3 item direct observation screening test, having at least one of these 3 items positive has a very high sensitivity but a comparably low but a good specificity that is available. And one for tech savvy parents, if you want to advise the parents regarding some ASD screening, one common problem that we have these days is parents themselves are not aware what is good eye contact, what is good interaction, all those. So there are video based screening tools that are available where parents can observe what is good eye contact, what is not, and then they can score. This gives a simple screening result. One copy is mailed to the parents and to you. And this can be done as early as 11 months of age. So finally, how do you educate parents regarding the red flags? There are good booklets available. This is the RBSK first 1000 days booklet. There are also the CDC milestone checklists that are available which can be shared with the parents. There is one free app from CDC also called as Milestone Tracker app. Often what difficulty we face is once you raise a concern about child's development, if they come for some other problem, parents don't seem to accept your point of view. But if the parents themselves come with a red flag, parents themselves approach you with a developmental concern and they accept our advice even better. So this one is the CDC Milestone Tracker app and the RBSK booklet which will guide parents regarding what are the age appropriate milestone and what red flags they should identify. One good website is again pathways.org where excellent videos are available for parents to understand what are the developmental milestones in various age groups and what are the red flags. What is good eye contact, what is joint attention, all those are very nicely captured in the videos there. You can direct your parents towards this. So with that I'd like to conclude, developmental surveillance can be and must be done for all children, and as I said, every visit to a pediatrician is an opportunity. Every vaccination card should also have a developmental milestone checklist that is there printed along with it. Formal tools like Denver Development Screening Tool, Ages and Stages Questionnaire can be used. ASQ is comprehensive but paid. Surveillance of wellness among young children is comprehensive but it is freely available, can be tried. And for autism spectrum disorder screening, MChat can be readily used. If MChat you don't have time, at least MChat Best 7 or the TIDOS can be done. And AS Detect app is a wonderful resources for tech savvy parent. And to guide parents, direct them to good booklets and websites regarding the milestone checklist. Thank you.
Thank you, sir. It was such an immaculate presentation, and I'm sure the audience, the postgraduates, would have really benefited from listening to this. And I think the Harriet Lane Handbook's chapter on growth, development and behavior is a very underrated read. It's a quick reckoner, and I think it has pretty much all the tables and even the GESEL figures. So the postgraduates should make use of, the Harriet Lane Handbook. It's really a ready reckoner. Thank you very much, sir. And I think we will now break for the Q&A session, followed by lunch, if there are any questions.
If we have any question from the floor?
Yeah, not as an examiner, but this thing. So when are you writing your book and this thing, your guidelines so that it will help people, because you are, a master of all these things. So I think you should make it simple in Tamil language and other languages.
Yes.
Thank you, sir, for the valuable suggestion.